is Miriam Tucker reporting from the annual scientific sessions of the American Diabetes Association. I'm here with Dr. Robert Andrews, who had some interesting findings about implementing diet and exercise regimens in newly diagnosed type 2 patients. Can you talk a little bit about your findings?
What we found was that individuals who stick to a intense diet program and individuals who stick to an intense diet and exercise program do much better than people who don't. They get better diabetes control, they need less medication, and they show that they halt the disease progress.
And what were your findings regarding the exercise portion?
What we found with the exercise portion is that adding exercise in, so if you're in the diet and exercise, you didn't do any better than the diet, but you still did very well compared to the usual care model.
Is it somewhat surprising that exercise didn't add any additional benefit?
I think it's slightly surprising. There is data from people who don't have diabetes that similar things are seen in the early time when you're doing exercise. So it seems that exercise needs a long time to start showing benefits.
So what's the message in terms of screening programs and what you want to implement initially in newly diagnosed patients?
I think the first message is give diet and lifestyle a chance. Don't go straight for drugs, because 70% of people in this trial weren't on any drugs at all. The second thing is that if you're limited by money and can only provide one training regime, we would say go for diet. If money isn't an objection, we would say go for diet and exercise.
So to summarize, you're not saying that you shouldn't exercise?
No, the things that we looked at were just related to diabetes. Very clear evidence out there that if you exercise, that you live longer, you get less cancer, and that your well-being is much better and you don't get depression.
Terrific. Thanks so much, Dr. Andrews. This is Miriam Tucker reporting from San Diego.